Okay, sir. On a scale from 1 to 10, 10 being the worst, how would you describe your pain?
About an 8.
Where would you say you feel the most pain?
Like right in here where the surgery was.
Here's the stats, doc.
Okay, we're going to start you on morphine, but only as needed. So when you feel you need more, just ring the nurse.
Okay, thank you.
He seems very nervous.
It's probably just related to him being a druggie.
He's just seeking drugs.
I really hope they don't think I'm here just for the drugs. I really am in pain. I hope they don't label me a drug addict.
He's just a homeless druggie that waited too long to seek help.
Yeah, he's probably just using his illness to feed his addiction.
And this is the story of Label.
I'm Elizabeth Langley.
I'm Karen Nippers.
I'm Leah Evans.
I'm Kayla Richards.
And I'm Daniel Cruz.
And this is Labeled.
Okay. An African American male patient, age 42, was admitted to a skilled nursing unit after surgery for head and neck cancer with lymph involvement, newly diagnosed. Extensive excision of the tumor had been done, and the patient had a newly placed tracheostomy and feeding tube. His history included years of living on the street and active drug abuse at the time of admission. The patient was very anxious on assessment, focused on his tracheostomy, pulling on the connections to make sure they were working, and complaining of pain 8 to 10 on a scale of 1 to 10, with intensity focused in the area of his surgical wounds. Although he receives morphine on an as-needed basis, he waits as long as he can to ring the nurse because he worries that asking for pain medication will label him with the staff. He also complains about not getting much sleep and thinking often of the poor choices that got him into this trouble. He has anxiety related to breathing through this tube, like I am not getting enough air in, and ongoing pain which gets less but never gone. He readily admits to risky behavior which has alienated him from family and social support for some time and is willing to discuss his years of drug and alcohol abuse. When the nurses and the attending physician describe the patient's condition, they explain that his anxiety is probably related to being a druggie and that his pain is mostly drug-seeking in nature, as evidenced by his calling for medication a few times a shift, and that he seems to watch the clock. They also notice that the patient is a homeless street person who waited too long to seek help. He hasn't held a job for some time, has no visitors, and is probably using his illness to feed his addiction.
This is a photo of what neck and head cancer looks like.
Okay, so the ethical dilemma here is that the nurses did not handle the situation correctly. They didn't treat him with respect, and they just assumed that because he was a previous drug addict, or he was a drug addict, that he was there for the drugs, and they did not treat him as they would treat a normal patient.
Okay, autonomy is defined as the ability to make independent decisions for oneself and to have those decisions respected by others. In this case, this man's decision was not respected by the nurse. He was just identified as a drug addict, and he was dismissed. Okay, justice. Justice refers to fairness, treating people equally and without prejudice, and the distribution of benefits and burdens. This man was not treated fairly. They just assumed he was a drug addict and that he was watching the clock for more medication, which probably was not the case.
Okay, beneficence consists of performing deeds of mercy, kindness, and charity. People take actions to benefit and to promote the welfare of other people. They didn't show beneficence towards their patient because they didn't take time to get to know who he was and realize that he's not a drug addict anymore and he's not going to abuse the morphine. Non-maleficence, the principle used to communicate the obligation to do no harm, the maxim or norm that one ought not to inflict or evil or harm upon a patient. Well, they were technically harming him because they weren't giving him the medication as he truly needed it because he was too afraid to tell them that he needed it that often.
Okay, so who was affected in this situation? The patient was affected because, like she said, that he wasn't getting the medication as he needed because he was scared to talk to the nurses. The nurses were affected because, or they could be affected by the hospital ward or whatever because they weren't treating the patient right, and if someone found out, they could get in trouble. And the hospital was affected because if the patient realized that the nurses were talking about him that way and they reported the nurses, the hospital could lose accreditation or something like that. And so that also goes along with what could happen. The hospital could have repercussions, or the nurses could lose their license, or other bad things.
Provision 1.3, the nature of health. Nurses respect the dignity and all rights of human beings regardless of the factors contributing to the person's health status. The nurses didn't really care about the male patient's health. They knew that he had a problem with drug abuse in the past and assumed he was only in the hospital because he wanted more drugs. Provision 4.3, responsibility for nursing judgments, decisions, and actions. Nurses are always accountable for their judgments, decisions, and actions. However, in some circumstances, responsibility may be borne by both the nurse and the institution. The nurses did not make very good judgments towards the African American. They knew his past history and frowned upon him because of it. They judged him for being a homeless person and assumed he was using his illness to feed his addiction. Provision 6.1, the environmental and moral virtue. Virtues are universal, learned, and habitual attributes of moral character that predispose persons to meet their moral obligations, that is, to do what is right. The nurses did not do what was right. They did not respect and care for the patients like they should have. They should have looked past the patient's drug issues. Instead, they were rude to the patient and thought he was only drug seeking.
Okay, so some additional information we found on Senol was this journal article called Ethics and Undertreatment of Pain in Patients with a History of Drug Abuse. So on that, or in that journal article, some of the things they told you to do was ask yourself, did I do my best to help a vulnerable patient? Because a previous drug addict is a vulnerable patient, because when they get drugs that they could become addicted to, it brings back their old habits. And another thing it suggested you do is ask if you treated your patient's pain without discrimination in the best way possible. And in our scenario, the nurses did not treat their patient without discrimination, and they did not treat it in the best way possible.
Another source we found are complaints, claims, negligence, and the practice nurse. This basically explains when the nurse failures to consider the diagnosis of the patient. They knew that he had just gotten out of surgery from neck and head cancer, and they didn't take into the pain that he was actually having. They were just assuming he was using it for his drugs. And then their attitude and manner towards the situation wasn't well, because they judged him as soon as they came in contact with him. They didn't get to know him or create a trusting environment for him either. And they didn't apologize for what they had done either. So,
in conclusion, the nurses were very judgmental and neglected their patients' actual needs. They should have created a trusting environment with their patient and before making assumptions about his needs.
Any questions?
Good.